Hello there, this is Dr. Lisa Shiver, and this presentation is the nursing process. The nursing process is unique to the nursing profession. This is a systematic approach that we use to gather patient data, examine and analyze that data, analyze and identify that patient's response to a health problem, and then design expected outcomes and interventions, take action, and then evaluate. So basically it goes from the start to the finish of care for our patient. It is the blueprint for patient care. There are 5 steps in the nursing process, and you got to learn these steps. Assessment, diagnosis. Diagnosis may be interchanged with analysis. Planning, implementation, and evaluation. Nurses always assess first, and each step is going to be dependent on the preceding step. So let's talk about assessment, since it is step 1. We're familiar with assessment. This is where we gather our information about the patient. It could come from a primary source, such as the patient's information the patient has given us, or assessment findings that we have found. But it also could come from secondary sources. It could be lab tests. It could be maybe a family's report. It could be from a chart. So we're going to gather all the information about the patient that we can collect. Then we examine the data. We're going to evaluate it. What does it look like? Does it fit the picture? We're going to start trying to pinpoint what's going on, or what's going to be our priority for this patient. Big hint, nurses always assess first. You would never do an intervention before you've assessed your patient. There are different types of assessment. It might be a focused assessment where we just focus on specific information related to a condition. For example, if you have a patient that has a leg fracture, well then if we're doing a focused assessment, we will assess color, sensation, pulses, edema, things related to that leg. With a full assessment, this is where you do a complete physical head-to-toe assessment. With a baseline assessment, this usually includes a full assessment, but also includes all information about their health status. So getting a detailed past medical history, social history, and this is all gathered on initial contact. The baseline assessment is often called the admission assessment. There are 2 types of data that we'll be looking for, subjective and objective. Subjective is what is said. Subjective is statements such as I'm itching. It's what the patient tells you. I have pain. It hurts here. Objective data is that can be measured or tested. I always remember objective is observed, such as a blood pressure reading, lab results, assessment findings. That's all objective data. So if it's said, it's subjective. If it's not, it falls under the objective category. Moving on to step 2 with our data analysis. We need to see, do we see a pattern or trend out of all the assessment data we've collected? We also need to compare our assessment data to the norms. If we obtain a blood pressure that's 168/102 on our patient, but we know normal blood pressure, or the patient's normal blood pressure should run 110/70, well, that's a concern. We have a variation from our norms. Or if we're assessing the patient and we hear rails throughout the lung fields, but we have been hearing clear lung sounds, or we know the normal should be clear, well, then we found a variation from the norm. From that, we can identify our problems, and problems are defined as an unmet need or anything that interferes with the person's ability to meet their needs. So what problems have we found? What issues exist? From there, we can formulate a diagnosis, and this is where it gets a little complicated. This is going to be new for paramedics. Once a problem is identified, we create what's called a nursing diagnosis. And a nursing diagnosis is not a medical diagnosis. When a patient is admitted to the hospital, the doctor writes a medical diagnosis. Well, nurses use nursing diagnosis, and we follow what we call NANDA guidelines. NANDA stands for the North American Nursing Diagnosis Association. They have come up with hundreds of nursing diagnoses that can be used when providing patient care. When you're looking at a patient, you also could find probably hundreds of nursing diagnoses that might apply to your patient in providing patient care. So with these nursing diagnoses, they provide the basis for selection of our nursing interventions. And please keep in mind, they may address an actual problem that the patient is experiencing, so an actual something that's going on, or a potential problem that may occur, something the patient's at risk for. So we deal with actual problems, but we're also looking at worst case scenario, what could potentially go wrong. Here's some examples of NANDA diagnostic statements. Activity and tolerance. If we have a patient with a COPD exacerbation or a CHF exacerbation, activity intolerance may be appropriate diagnosis for them. They may not be able to tolerate moving about. Body image disturbed. If we have a patient who has sustained some burns or some disfiguration, well, then they may have a disturbed body image. If we have a patient that is on a blood thinner, such as Coumadin or heparin, then they may be bleeding risk 4, may be an appropriate NANDA diagnostic statement for them. If we have a patient just had an acute myocardial infarction, then cardiac output decreased would be an appropriate NANDA diagnostic statement. An anorexic patient, nutrition less than body requirements imbalanced, would be appropriate for them. Or if we have a patient, we could go back to our CHF exacerbation patient again, fluid volume excess would be an appropriate NANDA statement for them. So you can come up with several NANDA diagnostic statements for each of your patients. And please keep in mind, they can be actual or they could be potential problems. I could have potential for activity intolerance, or I could have actual activity intolerance. And there are hundreds and hundreds more, and I'm going to include on Blackboard some information that includes all the approved NANDA diagnostic statements. When we're looking at writing our nursing diagnosis considering NANDA, we will start with the diagnostic statement. And again, this comes from NANDA. Risk for injury. If I have a patient that has orthostatic hypotension and has a history of fall, well then risk for injury would be appropriate for them. Then we have to follow that statement by related factors. Often we abbreviate R/T, related to. And this must be within the domain of nursing practice and a condition that responds to nursing interventions. So, in this example, my patient may be risk for injury related to the fact that they have generalized weakness. What you cannot put here is a medical diagnosis. You never use a medical diagnosis in a nursing diagnosis. So start with your NANDA statement and then put related to what? Here's a good example. You're caring for a 76-year-old female who's been admitted to the hospital after falling at home and fracturing her left hip. She complains of severe leg and muscle pain. We have orders for traction, a Foley catheter, pain medication, and surgery is scheduled for the morning. Her medical diagnosis is fractured left hip, but remember, I can't use fractured left hip in my nursing diagnosis. Wonder how many nursing diagnoses we could come up with for this patient. I've got some examples. Her actual problems are acute pain related to muscle spasms. She also has impaired physical mobility related to limb immobilization. She's going to be in traction. Her potential problems could be risk for impaired skin integrity related to altered sensation, or risk for infection related to invasive procedures. So I've come up with 2 actual problems and 2 potential problems, and the list could go on and on. There are some do's and don'ts when you are creating your nursing diagnosis. You don't want to be legally incriminating. In other words, don't hang yourself. If you write risk for injury related to lack of side rails, well, you just incriminated yourself. You've just said why. You just basically admitted to neglecting your patient. Also, don't use the medical diagnosis. You can't say they had a mastectomy related to cancer. Remember, no medical diagnosis in your nursing diagnosis. You do want to focus on the person's response to medical problems. And here's an example. Body image disturbance related to the effects of surgical procedure. And sometimes it's hard to come up with the related to statement. But as we practice this, and we'll go over some examples in class, it should get a little easier. Also, don't make things complicated. Don't use 2 problems at the same time. Just focus on one issue at a time. If you have 2 problems, well then write 2 nursing diagnoses. Also, don't just come up with a diagnosis. You must be able to support it with actual patient assessment data. We are very aware that there are books out there to help write nursing diagnosis and things like that, and I think that is a good tool. But if your nursing diagnosis that you use for your patient has nothing to do with your patient, that's when you get in trouble. So a lot of times you do better on your own coming up with nursing diagnosis as opposed to opening one of the books, looking at CHF, and then using the first nursing diagnosis in there that may not be applicable to your patient. So you've been warned. With step 3, we're going to plan some goals. Now that we've set our nursing diagnosis, we need to plan some goals. How are we going to help this patient? We need to develop realistic, patient-centered goals. Keep in mind, realistic. We don't need to shoot for the moon here. The patient will what? It needs to be measurable. So we could say the patient will report hip pain less than 3 on a 1 to 10 scale. Is that measurable? Absolutely. I could go back and check the pain level in an hour and be able to measure, well, did this improve? What you wouldn't want to say is the patient will feel better. Well, how are we going to measure that? It must be measurable. Goals also must be time limited. By when? We could have short-term versus long-term goals. I wrote one here related to the hip pain. The patient will report less hip pain within 1 hour, as evidenced by a pain rating less than 3 on the 1 to 10 scale. What I wouldn't want to do, considering our patient with the hip fracture is a new admit, you wouldn't want to say the patient will have no pain by discharge. That means we're going to let her sit here for several days in the hospital and not be worried about her pain. Well, that's not appropriate. So you have to make sure it's a realistic goal. Make sure it's measurable. Can we measure it and know it got better? And tell me when this is going to happen. Another example is if you had an obese patient and you wanted them, or one of our goals was to help them lose weight. Well, that's not something we're going to achieve in the short time frame, but we may set a goal that the patient will lose 20 pounds in, we could say, 3 months. And that would be appropriate because it's measurable. I can measure 20 pounds. And I've set my time limit of the 3 months. And it's realistic. So you're going to fill in the blank when creating your goals. The patient will what, by when, as evidenced by, and that's how we're going to measure it. With step 4 of the nursing process, this is where we put the plan into action. And this is going to involve a team effort, which includes reporting, actually performing the care, setting priorities, documentation, assessing and reassessing, and of course adhering to the policies. So this is where we actually take action. In other words, what actions are we going to do to help the patient reach the goal? What is the nurse going to do? So we've got our NANDA diagnosis. We've set goals for our patient. Now what is the nurse going to do? Or what can we do to help the patient reach those goals? I'm going to backtrack just a second. With step 4, we'll talk about our patient with the hip fracture. We said that she was going to report less hip pain within 1 hour as evidenced by a pain rating less than 3 on the 1 to 10 scale. So what can I do as the nurse? Well, it might be administer Demerol 25 milligrams IM. It might be position her in a position of comfort. It could be apply ice externally to that left hip. So when we're creating the interventions, we need to write out what is the nurse going to do to help the patient reach those goals. And again, we will practice this in class. We're going to work on a couple scenarios, and this should help bring all this together. The last step in the nursing process is the evaluation. This is where we look and see if those expected outcomes were met. This does require continuous evaluation, so it's not a one-time evaluation. We always evaluate the patients. It's an ongoing process. And we could have 3 possibilities. We could meet our goals, we could partially meet our goals, or our goals may not have been met, and that's okay. For example, our lady we've been working with the left hip pain or the left hip fracture. Well, our goal was she would have decreased pain or pain less than 3 on a 1 to 10 scale within an hour. Well, in an hour we'll go back and see, does she have pain less than 3? If she does, well then we can say our goal was met. If she says it's still at a 3, well we might say partially met. Or we could say not met if she complains of pain greater than 3 when we go back to evaluate. So during the evaluation process, we are going to evaluate those patient goals. Did our patient meet the goals that we set for them? Another example would be our patient that we set the goal for them to lose 20 pounds in 3 months. Well, say 3 months from now we see them. Did they lose those 20 pounds? If so, goal met. Maybe they lost 18 pounds. Well, then we could say it's partially met. And if they gained weight, or maybe they just lost 2 or 3 pounds, we might say not met. So we've always got 3 possibilities. And don't feel like you have been defeated if you don't always meet your goals. Maybe we just need to tweak the goals to be a little more realistic for your patient, and sometimes that's the case. Again, we'll talk more about this when we get to class. I've got some great case studies we're going to work on as a group, and we'll practice writing nursing diagnosis and goals and all of that. Don't forget to check out Blackboard for the list of NANDA diagnosis.